Yes, so the outreach campaign, the mailing that we did was actually a part of a prior budget proposal that the legislature enacted and the governor signed as part of the budget. And so we've been working on that.
Last year's budget?
I believe it was last year's budget, or it might have been the year before. I can confirm that, but I'm pretty sure it was last year's budget. And so we had worked through a stakeholder process on developing the notification and the plan for the notification. And as the director said, it went out in February.
And it was exclusively a mailing. It wasn't like a statewide robocall or anything like that, or postcards?
So we did a mailing of to parents of children 0 to 3 who hadn't had a dental visit in the last year. And then we've been following that up, and it's ongoing right now with a call campaign to those households as well to ensure that they receive the mailing, encouraging them to ensure that their child gets in for services, seeing if they have questions, and helping individuals find providers.
And that's through
through our contractor with our contract with Delta Dental.
Okay. It'd be interested to know more and get materials on what
Absolutely.
occurred and see what the impact was in greater Los Angeles. Several of us represent Los Angeles in various segments, and someone in the San Gabriel Valley, well, everybody knows Ed Hernandez, so they always call him, but someone who's just in Pasadena or something like that may call someone in Long Beach, may call someone in East Los Angeles. So it's good that we're aware. If it passed in last year's budget, I should be aware of it. I don't know that I was aware that it did. So we'd like to work very closely with you. If that runs, do you directly supervise that aspect of Delta Dental's responsibilities? Who's the direct report?
Me directly? I do not directly.
Okay, so
but
who does that?
It's within. It's our dental division.
So you have a dental division. Are they here too?
Mm-hmm.
Who's the responsible person, so we know exactly who to go to?
So, I'm ultimately the responsible person. Mary is
Step right up. The buck stops here.
I'll take it. So I have 2 chief deputies. So Mary is one chief deputy. She oversees all the program and policy area.
Has she been here more than 6 weeks?
Yes.
Okay.
At least 8.
Okay.
And she hasn't quit on me yet.
All right.
And then she has deputies under her, and under one of her deputy directors is the dental division. But ultimately, Mary is handling all the budget issues, and she's the state Medicaid director. So I would just suggest that you work with her on the mailing directly.
Thank you very much, Mr. Chairman.
Sure.
Assemblymember Wood had a question. Then we're going to go to Dr. Pan after Assemblymember Wood.
Great, thank you very much. I'll go back to, you mentioned you've been surveying dentists, and
correct.
By phone, paper. How many people? Was it all dentists? Or?
It's been by phone, and hold on.
It was a sample. It was a statistical sample of dental providers.
Okay, and that was done when?
In November and December
of this past year, 2014.
So was the purpose of that to extrapolate, to give you? What was the purpose of that?
I think it was based on partially the audit itself, and I think it was we were recognizing that we needed to get a better. We needed better information from the providers themselves, and so we went on a survey where we were trying to find out from providers in various areas of the state, are you taking Denti-Cal? Are you taking new members? If you're not taking new members, what are the reasons? And it was 22 questions that was designed to kind of get at some of the issues. What you're talking about are, we are looking at our administrative procedures. We are looking at our application process. We are looking at other things. And so this sampling and survey was supposed to be designed to get at some of the things on a broader level rather than anecdotally having people just say this doesn't work for us. And so that's what we were attempting to do.
Okay. And I'll go back to, I go back to something you mentioned. The one thing that you guys didn't agree with was that provision about looking at a provider benefit ratio. So, because the comment, your comment said it was more related because we don't have that information, doesn't really exist. But the actual response says that, in quote unquote, this requirement is not part of the required reporting process, and that was the reason for not doing it. So, has something changed? Because that response doesn't match with your response. Well,
so I would say this, and this is the Wilford Institutions Code reference in the thing. My response was based on the fact that the statute calls out for certain things, including but not limited to. But I think that in in saying that, it's not necessarily a good way of us just saying we're not sure what that ratio should be. And so that was kind of my simplified version of just saying the reason why we're not doing it is we're not quite sure what that ratio should look like.
Actually, I would have liked that answer personally, because I guess for me it's just a relative measure. It's not meant to be that precise. So it's kind of nice to see. In some counties the number is here, in some counties it's a relative thing. So that was really what I got. We've I guess what I would like to kind of hopefully leave here with is this. I mean, we hear from beneficiaries that it's not working very well. We hear from providers that it's not working very well. We heard from the California State Auditor that it's not working very well. You've agreed to 23 of the 24 recommendations. To me, that kind of feels a little bit like plugging holes in a ship and trying to keep the whole thing afloat. And I guess what I would really like to see is an opportunity to collaborate and look at the program more holistically and say, you know what, this program, we could plug all the holes in the boat and it may, the engine may fail or something else, because we're not really, I don't believe we're getting to the fundamental issues of why this program works and why it doesn't work. So I would love to see a commitment at some point about, we need to look at this entire program from the bottom up and say, what works, what doesn't work, and can we design something that works for the people of California? Because the costs are not going to go down; they're only going to escalate. And if we don't incorporate prevention type programs and things like this, we're going to see more and more of these problems pop up. So I don't expect an answer today, but I'd like people to think about: can we be delivering this care differently? Should we not be looking to build a program for them? What would it take to build an ideal program? Because I just don't think that even if you've fulfilled all these 23 things and plugged the ship, that gets us very far down the road. The first storm that comes along might blow all the plugs out.
Right. I mean, I appreciate that, because I think it's, like I said, it's a complicated problem and you can't solve it with one particular measure. And so I would love to have that conversation. I mean, I've been thinking, how do we do certain things in different ways? But I think as well, it's always an interesting opportunity when we have waivers in front of us, or we have it's an opportunity to think about how do we do a better job with the funding that we have, or new money that we can bring down from the federal government. And one of the big things about our waiver and a lot of the language that we're talking about is this concept of whole person care. Mm-hmm. And so to the extent that you are saying that in a slightly different way, which is how do we design a system that is looking at not just setting aside someone's oral health and putting that on a completely different program, and setting aside their physical health and putting that in a different program? Is there a way to do things in a different manner? We are certainly always open to looking and talking about that. So,
well, programs, and Mr. Ridley Thomas mentioned this. Programs that happen out there, that volunteer programs would get together. We're going to have one again next week here in Sacramento. The volunteer program, they'll take hundreds of people to put it together. We'll see 2,000 people. We'll deliver $1.5 million worth of dental care. That's not really a great system. That's not a system. That's not the way we should be delivering care in California. So I just would love to be able to go back and say, can we look at something? Even if it becomes a pilot program somewhere, can we not look at a different way of doing business here that might provide an opportunity to create a system that actually works, rather than this adversarial? There's only so much money, and I get all that, but it's that part's not working for it's not working for you. It's not working for us. It's not working for the people of California.
Sorry.
Oh no, sorry. And I was going to say we are happy to come in and meet with you, or do a convening of individuals and invite legislative staff or something. I'm completely open, and I think Mary is too, as part of both the waiver and ongoing as a program. If there's a better way to do it, then we're certainly open to that. So thank you for that.
Thank you.
What I was just going to add was exactly that I do think that our Medicaid waiver does present an opportunity to maybe pilot some things that are very much different from what we do today, and would be certainly happy to talk about how do we think about that. As Jennifer mentioned, we do have these whole person care pilots. How do we make sure that dental is a part of that? But what else can we be doing to think about the structure of a system that we could pilot through that kind of process to demonstrate that doing something different from what we have today might be the better way to go about this.
Yeah, and bear in mind that statistically, Deni-Cal is 1% of the Medi-Cal budget.
Yeah.
So,
Yeah. It's amazing how
yeah.
$1 billion. Mm-hmm.
Yeah, $1 billion is only 1%.
Yeah. Senator Pan.
Thank you. I have to admit that I'm going to be a little less patient than my colleagues, having been in practice. And as I said in my opening remarks, I think it's been way too long since we've done something. I've seen too much suffering. I've seen too many children suffer. Not sure I can stand it anymore. And this department needs to change. So first of all, regarding the report, there was a violation of state law. I know that Senator Monning brought this up. It's great that we're going to change that. But I think he also mentioned there's obviously roads are confidence. What should be the consequence? Your department director, what should be the consequence if, once again, there's a violation of state law like this? What should we as a legislature do? At this point, they said, well, too bad. Now that the auditor looked at it and we blew it open, now I guess we'll fix it. But it's been state law for a long time, and I know you've just been in the seat for a few weeks and you're the new director, but what should be the consequence? We pass something this year, let's say, in the budget or whatever else, and suppose the department doesn't follow through with it. What are we to do? Who's supposed to be responsible? What should we do about it?
Mm-hmm. So, fair question. I think first and foremost, it is never either comfortable or pleasant to have a legislative, hearing like this, where we're called in and asked, really hard questions because they are difficult. I know that the reports weren't done, and that's not an excuse, and I'm not making excuses. And so when I say that we're going to do it, we're going to put them on track and we're going to do them because the law says that. I would also say, there is a power dynamic between the legislature and the executive branch, right? You appropriate our funding. So we, in some cases, are very responsive to the legislature through budget hearings and other ways. And so I would say that we work together closely, but we're also mindful of the fact that the legislature holds a lot of power over departments, and so
perhaps can we put a trigger in if there's a violation of law that certain funds automatically flow? After all, the governor does sign these laws too, so there was an agreement from the administration passage of these laws. There just doesn't seem to be there doesn't seem to be consequence, and I'm concerned about that. So I think that it would behoove the administration and the department to put in confidence-building measures that if there's future violations, there are actually direct consequences that are tied to that. Certainly we can try to withhold things in the budget or something like that, but ultimately, I'm just concerned. I mean, that this is very disturbing. The other question is, I know we talked about ratios and provider ratios, but I think something has been brought up, and I want you to make a commitment here. In terms of an accurate directory, after all, you have a ratio, you have number of beneficiaries, and you have number of providers. And if one of those numbers is inaccurate, you don't have an accurate ratio. So there's been comments made about the directories not being accurate. Dr. Woods has admitted that he hasn't actively seen a Medi-Cal patient, Deni-Cal patient for at least over a year. He's still on the directory. There's been comments made that all you have to do is one procedure entire year, yet we're talking about ratios of 1 to 2,000. I think that if only one procedure was done in 2,000 patients, that would probably not be considered adequate access. What is the department going to do to address the issue of an accurate directory, and what's the timeline for fixing this directory so that's actually something that we can actually respect and feel confident that the information we have is accurate?
Okay. Fair question. We actually went and looked up Dr. Wood's file, not to call him out publicly, but since he's brought it up now in a couple hearings that I've sat here in, you signed a piece of paper, and this is government at its best. You signed a piece of paper about 5 years ago where you said that you were no longer accepting members, but it basically said keep me on the file. So we never took you off. So that's why you're still on. But I think, the larger issue, Dr. Pan, about provider directories is a challenging one. Sometimes provider directories are only as good as in terms of if a provider closes their practice, sells their practice, moves, it is sometimes hard to keep those up to date. I think that the other frustration that I would express with a fee-for-service network versus a managed network is that, it is an imperfect system at best. Denti-Cal is actually unique in that there's not a provider directory on the Medi-Cal side. Denti-Cal has that, which is not necessarily perfect, but it's certainly better than what we have on Medi-Cal. I think that I'm completely open to talking to our vendor to say, what can we do? Because they actually manage the network for us in terms of, the providers and, that they are receiving claims through and things. So is there a way that we can do a better job of touching those providers on a regular basis to say, are you still accepting, patients you haven't billed in a while?
Certainly one of the things, because we pay money, right? We pay claims.
Right.
So
We pay claims.
certainly using the claims data, we can look at, so there's provider directory, do we have a list of people who actually take Denti-Cal? But I think there's also looking at, given the number of claims assigned to each provider, hopefully the department is looking at that since they're paying checks out, state money, that you can actually come up with an accurate ratio per FTE or something like that, given so that we have a better idea. You have some providers who are doing mainly Denti-Cal. I think we heard from Western Dental, a lot of their folks. Do you have other ones who are doing a small portion? We also know there's some that just take care of them for free, but obviously I know you can't count that. And I think that's a shame. We should be very ashamed that that has to happen here in this state. Basically we should be able to come up with a much more accurate measure of that ratio. And I do believe that what the auditor recommended, the one that the department says they can't. I mean, I think there's actually accurate information there. We can look at this. I mean, if we refine it in a way that looks at the cases and the claims, I think we can come up with a much more accurate measure of what's going on. And I do believe we can find benchmarks for that. So I certainly hope the department will reconsider its opposition to that. And I think the auditors in their presentation also mentioned that it is pretty consistent with actually another state law that was passed. So hopefully let's not violate that state law as well. The other issue is I know that Dr. Woods mentioned about provider survey. Since I, in my past life, did lots of provider surveys, can you tell me what the sample size and the rate of return is for that survey, a response rate?
It was a phone survey, and I apologize. I don't seem to have the number of the sample size, but I will certainly get that back to you.
And the response rate?
So it was what we did was we called and we left messages. We called back, but the exact number of people, I apologize. I will do need to follow that up.
So obviously, in an analysis of any survey, as someone who's did research on provider service, if you don't know what the response rate is and you don't know what the sample size is, you don't know anything what that survey is telling you. So the fact that it's not at the top of your head. Okay, well, so clearly without that information, we don't know what the survey actually tells us because the methodology.
Because it was done in November and December, I know program staff was still compiling it, and so they'd kind of given us some
so you'll get back
factoids, but we're happy to provide it when we get it compiled.
We would definitely like to see that, including the methodology, because obviously without the methodology. And then you did mention that you're going to be doing the rate survey in July, but what I didn't hear from you is a commitment that we're actually going to fix and do something this year so that we get something started in July. And while certainly I agree that Denti-Cal issues are multifactorial, that's not an excuse to say we're not going to do anything. And clearly the payment rate, the fact that we're paying 35% of the national average, that dentists are seeing patients for free because it's cheaper than seeing it without that, we have every sign that payment rates, we may not know exactly what they should be, but we know we're way too low. Given the cost of practice here in California, given everything else. And it's great you have the waiver, and I'm looking forward to seeing the waiver. Although I have to say I'm a little skeptical of pilots. I like pilots, but the problem is that Sacramento GMC was a pilot. It was a 13-year pilot that failed, that unfortunately, it didn't take the department. It took our County First Five Commission to blow the top off of how badly it failed. So hopefully we don't have any more of those pilots. All right. Again, confidence building, better put more things in place. But what are we going to do to at least improve I'm not saying that now we're going to pay like higher than the national average, but how are we going to get a lot closer to the national average? Even if we doubled rates, we'd only be 70% of the national average. That would hardly be like, oh, we're throwing money out the window. What are we going to do so that starting in next fiscal year, that we actually at least make a step in the right direction, that we can stop the suffering, that we can stop what's been happening? I'm not saying that we are going to fix it all, but at least we're taking a step. That what are we going to do that's going to start, not a survey, not something, but something that's actually going to help the patients, the kids out there. What are you going to do? What are you going to propose to do starting in July, so that on July 1st, something is going to be different, so that that kids are going to be helped? What are you going to commit to now?
So I'm struggling a little bit. The question is, what is going to be different July 1st versus?
Yes, than now. Then now, the last 10 years, the last 15 years, we're talking about something that's been going on. How long does it take?
And
so are you going to propose a rate increase given the findings of the auditor report and all the things that we talked about here?
So
of any size.
So a rates discussion. We work within the administration to, we're right in the middle of a budget revision for the May revise. To the extent that the May revision comes out and the legislature is not in agreement with what the revision has in it, we would then be working with, you on a, kind of an analytical and data basis to provide numbers. But at a certain point, if the legislature determines that one of their budget priorities is a rate increase, and if that's not to date that's not in our January budget, that would be something that the legislature would have to negotiate with the governor. That would be something that we would again be participating in as part of the administration. But we're kind of in the middle of a budget cycle now, and then there's the May revise coming. Okay.
Well, certainly, I think many of us are very disappointed that, given the findings of this report, that there was nothing really that was in the proposed budget in January. Hopefully, that will change in May, because, is this acceptable?
Yeah.
The findings are in here.
Yes.
And if it's not, then what are we going to do to change? Are we going to do, what are we going to change? What are we going to do to change? And this is not just a report, oh, this happened in 2014 and everything was hunky-dory in 2013. These are things that have been going on for more than a decade. And so we've had more than enough time, so let's fix it.
Mm-hmm. Thank you for your comments.
Thank you.
Thank you very much. I think that you can certainly hear by Dr. Pan's comments that he is not satisfied, and I share in those comments wholeheartedly. Our children of the state cannot wait. I was hoping that your response to Dr. Pan's question would be, even though the administration put forth, that you will say, I will move forward with the administration with some recommendations, even though they may disagree with the administration's recommendation, because we need someone to stand up for our children, because our children are not being serviced. Our children are not getting the care that the taxpayers of this state of California has provided resources for them to receive. And so I think real leadership with leadership should take place. And I'm going to stop there. I'm going to ask Mr. Bonta to please comment, and then I'll come back.
Ms. Cantwell, good to see you. I've seen you a number of times in different committees, and look forward to more in the future. And my position on increasing Medi-Cal provider rates, and I'm going to continue to push that and ask for your collaboration and work together on it. And I think what we're seeing through the joint hearing that you participated in, I think it was the week before last, I'm losing track, maybe last week, is that we have a very broad coalition of supporters in the legislature, both Senate and Assembly, Republican and Democrat, for an increase in the provider rates. So we're going to continue to share that message with the administration, but I think it's coming out loud and clear, and today is another example of that. Just a couple quick points I want to share. First, I want to thank you for saying that strengthening the Dent-A-Cal program for children is a top priority, and also for committing to completing a review of the reimbursement rates as required by state law in July of this year. So just a couple follow-up questions on that. First, my understanding is that there were some indications that because of, I think it was fiscal climate and workload, the reimbursement rate reviews weren't able to occur earlier. And so question for you is, in the January governor's proposed budget, there was no request for additional FTEs to help with the review of the reimbursement rates. Why not? I mean, that's a place where we can collaborate, where you can ask for appropriation, or we can provide you the resources you need to do the things you're required to do by law and the things that we care about. So why not? And also just want to invite that type of outreach to the legislature in the future so that we can provide you the help and resources you need to do the job that we all want to see get done.
Yeah, thank you for that. I think that when it was determined through the audit that the reports weren't being done, we are sensitive to how we request positions, in any budget environment, and so usually what we do within the department is look to ourselves to see if we can either redirect or temporarily reassign staff to help do some of those workload items. And so I believe in this instance, we, kind of quickly said, all right, who here is someone that either knows the program or has worked with the data before, and so I think that. It's from within our own staff and workload that we're handling it. So I think if we're going to ask for positions, we will probably come and ask for something else because we try not to do that very often. And so I think we've got it underway with existing resources.
Okay, thank you. Also, the July rate review, I want to drill down a little bit more and see how that interplays with our budget process. We have a budget. We're going to pass it on June 15th. Mm-hmm. Then afterwards, we're going to have a rate review, one of the first ones that we've had in a while, and from DHCS, and it might say that we need to double our rates or increase them to some degree to increase access to children and others in the state. So how do we deal with that? And I want to go back to your point about this being a top priority. I think action shows the priority, and is there a way to expedite the reimbursement rate review so that it can correspond with our budget process? So if it says we need more money, we can bake that into the budget, given the support that you see up here for a potential increase in provider rates?
Okay. First off, I haven't seen one of these rate reports yet, so I'm not quite sure what the data looks like in terms of what it shows or not. I have a feeling that what it probably does is say, here's what the rates look like as compared to commercial, fee-for-service in other states or something like that. It may not come out quite as clearly as what you were indicating in terms of, the report's not going to just make a recommendation of add X number of dollars into the program. But I think that the rate study is, to the extent that it could be expedited, I can certainly check and see if that's something that we could do. I don't know, given the track that we're on, that it could. I think that it would best be suited to flow into next year's budget process if that was going to be something that either we as an administration or the legislature wanted to consider. And then to the extent that there are annual rates going on, we may need to have a conversation about, do you do like a 6-month rate, or do you do a year and a half to kind of sync it up on a different time frame so that it is more in keeping with the kind of budget year as opposed to coming in right after. I think I would agree it's a little bit of an awkward time frame. So the only other thing I wanted to mention, and this was part of the rate conversation, we as a state, if Medi-Cal is a three-legged stool, it's provider rates, its population, in terms of eligibility, and its benefits. And so you have to balance that three-legged stool. And so we as a state have tried really hard to do all three. And Mary has certainly been a critical part of this, is we have creative ways that we have worked with providers in other areas to increase rates. And so, while we haven't provided significant general fund rate increases for a long time, as noted in the report, we have done provider rates and provider taxes to increase those rates using taxing mechanisms. And so to the extent that there was a willingness by stakeholders, meaning providers, we have done it before and we could certainly do it again in this area. We're talking to the plans obviously about a managed care tax, and so that is a way that we generate funding for the Medi-Cal program to draw down the federal dollars. And when you look at our Medi-Cal estimate, that's a significant amount of money that we use annually to help provide overall support to the Medi-Cal program. So I didn't want to let the opportunity pass when we talk about rate increases that is one mechanism that could be considered.
Okay, two final questions. Do you expect the May revise to include any increases to provider rates in the Medi-Cal program?
That is going to have to be something that comes with the May revision. So it's a process that we do internally within the administration. Up till now, I have to say that we are still finishing the estimate, even as we speak. Right? It's the May revise is kind of we've done the November and we're now kind of finishing up, and I think the estimate's over 1,000 pages in terms of all the different policy changes and stuff. But really the governor has the first order in terms of understanding what our recommendations are, and then it's his budget, and so we wait until he has released the budget before we talk about what's actually in it.